Now, summarizing all these first line anti-tubercular drugs, let me tell you which first line anti-tubercular drug is active against the rapidly growing organism, which tubercular drug is active against the organism which is present within the caseous material. Now, if you take the discussion here, you take against the rapidly growing organism. Right, against the rapidly growing organism. Against the rapidly growing organism which is present in the wall of the cavitary lesion. Right, which is present in the wall of the cavitary lesion. The drug which is more effective is the isoniazid. Right, the drug which is more effective is isoniazid. Whereas, you take in case of the slowly growing organism. Right, you take in case of the slowly growing organism, and this particular slowly growing organism is also intracellular organism. So, to this slowly growing intracellular organism, the drug which is more effective is pyrazinamide. Whereas, you take the organism which is present within the caseous material, right? We call that as spurters. Right? We call that as spurters. Spurters are those which are present within the which are present within the caseous material. Now, to these spurters, the drug which is more effective is rifampin. Right, to these spurters, the drug which is more effective is rifampin. So remember, against rapidly growing organism which is present within the wall of the cavitary lesion, the drug which is more effective is isoniazid. And against the slowly growing organism which is an intracellular organism, the drug which is more effective is pyrazinamide. And against the spurters which are present within the caseous material, the drug which is more effective is rifampin. Right? These are very, very important multiple choice questions. So, summarizing the first line anti-tubercular drugs, let me tell you which are the cidal agents, which are the static agents, and let me tell you which are the hepatotoxic drug and which are not hepatotoxic drugs. Now, so first and foremost, you take the drug that is isoniazid. Right? Isoniazid is represented in the form of H. This particular isoniazid action, if you take this isoniazid, remember this is a bactericidal agent. Right? In rapidly multiplying organisms, it is cidal, whereas in the organisms which are not multiplying, which are in the resting state, this is a bacteriostatic agent. Now, whether this particular drug will cause hepatotoxicity, right? Yes, this particular isoniazid is hepatotoxic. Now, if you see the bacteria which are inhibited, right? If you see the bacteria which is inhibited, remember with isoniazid, both intracellular and as well as the extracellular organisms will be inhibited. Alright, both intracellular and as well as the extracellular organisms will be inhibited. Next, you take the another important drug, that is rifampin. Rifampin is also a cidal agent. Right, rifampin is also a cidal agent. And if you see this drug, yes, this is also the hepatotoxic. And the bacteria which are inhibited are both. That is both intracellular and as well as the extracellular organisms. Now, you take the pyrazinamide. Remember, you take your pyrazinamide, this is also bactericidal agent. Right? And yes, this is also hepatotoxic. But remember, the bacteria which are inhibited is only intracellular organisms. Right, the bacteria which are inhibited are only the intracellular organisms. Next, you take the other drug, that is ethambutol. Ethambutol, remember, it is a bacteriostatic agent. Right, it is a bacteriostatic agent. And if you take the hepatotoxicity, remember, it is not hepatotoxic. And this ethambutol is active against both intracellular and as well as the extracellular organisms. Next, you take streptomycin. Right? Now this streptomycin, remember, this is bactericidal. And if you take about the hepatotoxicity, remember, this streptomycin is not hepatotoxic. And this streptomycin, it is active against the extracellular organisms. Alright, this is active against the extracellular organisms. Okay, so these are the summary of the first line anti-tubercular drugs.